Spain is one of the largest COVID-19 outbreaks in Europe. I am fine for the moment, other than missing some of my friends and my family. It's been one of the oddest weeks of my life, and it's similarly odd for the rest of the nearly 50 million people in Spain. Not only does everyone in Spain have to stay inside, but also they have to live with the police drones and drones patrolling the streets to keep pedestrians at home. They have to put up with an uneasy, rare silence, and they have to watch one of Europe's best healthcare systems struggle to treat patient after patient. Spain has now 281,000 plus cases and 28,000 plus deaths. This is not accurate because every single day, Spain coronavirus increase. Although the pressure on Spanish hospitals is slowly beginning to ease, Spain remains the world's worst hit countries by the COVID-19 pandemic so far. There is no doubt that these countries share some several characteristics. They are highly social citizens, fair weather, densely populated cities, physically affectionate social interactions, and large elderly populations. Yet, as both witnessed the overwhelming influx of COVID-19 patients began to subside, it is now clear that timely government action could have potentially saved thousands of lives. Unfortunately, overconfidence was another trait shared by the governments of Spain in the critical weeks leading up to COVID-19's explosion. Authorities in this country underestimated just how fast the virus could spread and how quickly it could push their healthcare system to the verge of collapse. Spain, despite the added advantage of seeing what was happening in Italy, also failed to recognize the exponential spread in the critical early weeks of the virus introduction into the country. In Spain, the first COVID-19 case was reported on January 31. The first death occurred on February 13, but it was not diagnosed post-mortem until early March. On March 8, the same day after a quarantine zone was declared across much of northern Italy, the Spanish government was encouraging people across the country to take the streets for International Women's Day protest. At that time, 10 people had already died of COVID-19 in Spain, and 520 cases had been confirmed. On the day of the massive protest, Spain's health minister held a press conference telling people to stay home if they were feeling ill. In Madrid, Spain's hardest hit region, 120,000 people packed into the city center to support the gender equality. The same day, supporters gathered in crowds as large as 60,000 in dozens of other Spanish cities, as other large events like football games and political rallies continued in full force. In the late February and early March, there was no strong voice in the government warning of the seriousness of the pandemic. As a result, Spain failed to stockpile medical equipment, tests, and protective care until it was too late. Issues compounded by budget cuts to the healthcare system in the years of austerity following the 2008 financial crisis. So far, around 20,000 Spanish health workers have been diagnosed with COVID-19. It wasn't until the day after the women's protest that authorities claimed to have noticed a massive uptick in the spread of coronavirus. On March 10, all gatherings of more than 1,000 people were banned in the cities, including Madrid. Just 6 days after International Women's Day, the country was under total lockdown. Like in Italy, in the week of limbo, between normality and full lockdown, thousands of people living in cities like Madrid fled to their second residences or hometowns to avoid being quarantined or cooped up in the city. On March 9, Spanish Prime Minister Pedro Sanchez was filmed greeting people with the customary 2 kisses on the cheek, a gesture now viewed as recklessness. Hardly a week later, and Spain was engaged in a full-fledged war against the disease. The spread had gotten so out of control that the country imposed one of the world's strictest lockdowns on March 14, one which lasts until at least April 25. Everyone was told to stay at home. The national government centralized the sanitary response, and the country eventually released its biggest ever financial stimulus, hoping to cushion the economic shock of the pandemic. Spain quickly fell behind in testing and only had enough resources to diagnose the most severe cases or those in essential workers. By that time, the state of emergency began. The country now aims to follow the lead of Veneto and is devising a strategy to test the populations more broadly. Spanish authorities have begun to loosen the nationwide lockdown in place since mid-March, one of the world's strictest, which only allowed people outside to walk their dogs or shop for groceries. In late April, children under 14 years old were permitted to go outside for the first time in 6 weeks, and Prime Minister Pedro Sanchez announced a plan to return to normalcy by the end of June. On Monday, Spain began lifting restrictions by region, allowing small groups to gather and dine outdoors, and small shops to reopen. Hair salons are also open, but about half the populations, including residents of the 2 largest cities, Madrid and Barcelona, remained under tighter restrictions. Despite easing confinement measures, Prime Minister Sanchez wants Parliament to extend the current state of emergency until July. The coronavirus outbreak has severely damaged Spain's image as one of the healthiest nations in the world, which has long boasted a robust universal healthcare system and the highest life expectancy in the European Union. The pandemic has knocked out thousands of the country's health workers, who make up nearly 20% of its confirmed coronavirus cases, the highest reported share in the world. Despite of this pandemic, Spain will be not just welcoming but encouraging international tourism starting in July, the Prime Minister said on Saturday. After 2 months under one of the world's strictest lockdowns, the virus has become manageable in the country, but it has not been eradicated. Unfortunately, the story is a continuing one, as Italy, failed to learn from the Asian examples, and Spain in turn failed to learn from Italy. Other countries like the United States are continuing to prove how deadly an overly optimistic attitude can be in a time of global pandemic. Experts' understanding of how the virus spread is still limited, but there are four factors that most likely play a role: how close you get, how long you are near the person, whether that person projects viral droplets on you, and how much you touch your face. If your community is affected, you can help reduce your risk and do your part to protect others. Wash your hands. Keep distance from sick people. Prepare your family and communicate your plan about evacuations, resources, and supplies. The world is pretty topsy-turvy right now because of this global panic around coronavirus. If you are feeling overwhelmed or stressed by it all, be reassured that this is a normal response. However, it's important to go easy on yourself and to take time for self-care. You must stay active. It's pretty well known that exercise is really good for both our physical and mental health. Take 10 to be zen. When we're stressed about something such as coronavirus, our thoughts tend to speed up. Taking 10 minutes or so to practice mindfulness can help reduce a sense of calmness. Keep in touch with your family and friends. Even if an in-person meetup is off the table, try to stay in touch with your friends and families via text, messenger, WhatsApp, FaceTime, or a good old-fashioned phone call. Ask them how they're feeling and share your own experience if you feel safe to do so. Try to make a good homemade meal. Good nutrition is always important, but during stressful times, there's nothing better than a tasty, healthy homemade meal, especially if you made it yourself. This I might going to tell you. Take a break from the news. Between the news and social media, we're all feeling saturated by coronavirus updates right now. It's important to stay informed, but try to limit your media intake to a couple of times a day and use trusted news resources. If you catch yourself turning to social media because you're feeling isolated, take a break and spend time on another activity. Try to watch or read something uplifting. Distraction can be a good thing. Watch something that you find uplifting and allow yourself to zone out from what's going on in the world. YouTube is a great option too. The wearing of masks in public will be mandatory from Thursday, according to the latest update to the official state bulletin. But as ever, there are certain exceptions and stipulations to the controversial new ruling.
Kakapoy man magmask ka.
The new order dictates that masks must be worn in shared indoor and outdoor spaces where it is not possible to maintain a distance of 2 meters between one another. They must also be worn on all public transport, a rule which had already come into force earlier in the COVID-19 pandemic. However, the government has not warned of sanctions or fines if you are caught without wearing one. Yet, legal experts believe people will be subject to the so-called gag law, meaning possible fines of between €100 to €600 for minor breaches. There are also several other exceptions to the rule. These include people who have some form of respiratory condition that may be aggravated by the use of a mask, or individuals for whom the use of a mask is not feasible due to justified health reasons or owing to a disability. Additionally, you can do away with your mask if it is incompatible with an activity you are practicing, like running, jogging, or cycling. You can also remove your mask in emergency scenarios or if it is absolutely necessary. According to the Health Ministry, the use of scarves, bandanas, or shawls as masks will not be permitted. Take care, everyone. Stay safe and healthy. That's the most important thing right now.